When was the last time that our life was hijacked for 12 months in a row? Couldn't travel, couldn't see our loved one, couldn't do the things we want to do, couldn't go to the restaurant. Do we want to go through that again? And if we don't want to go through that again collectively, then we need to implement the recommendation, the set of recommendations. We can blame China for losing few days, and we can blame WHO for losing maybe a week before, calling the public health emergency of international concern. But basically, 90% of the country around the globe sat on their hands for like 4 to 6 weeks. The reality, it's on them. Fairly early on, it was pretty clear that most likely there was human-to-human transmission. And I'm pretty convinced that this should have been communicated a few days earlier. And it is important because that was, for me, one of the wake-up trigger call or something big is going to happen. I don't think it hit everybody the same, but people who tackle epidemic knows that human-to-human transmission of a novel pathogens, you got to pay attention. It's about making sure that we distribute the vaccine and making sure that we are enabling manufacturing and scaling up of manufacturing of vaccine with voluntary licensing. And if it doesn't happen, then we should think about waiver on intellectual property. My biggest worry actually is that high-income country will end up fairly soon in the next few months having the upper hand on COVID-19, and then we're going to be faced with low and middle income country still being in the fight for it, and it's going to become the neglected pandemic in the low and middle income country. So it is important that we get the finish line together. I think that's the humanitarian thing to do. That's to be in solidarity, even for our own domestic self-interest. It's still the thing to do because we don't want to have a variant of concern coming and knocking back at our door in a few months down the road, where it will have escaped the vaccine we've been vaccinated with.